I want to welcome you to this evening, the Spirit of Science, Science of Spirit. On some level, all of us have a connection to cancer, and tonight we are a community united to learn and to heal and to be together. And the vision of Spirit of Science, Science of Spirit, was to raise awareness of the importance of psychosocial support as a critical component of cancer. And the aim of this evening is to explain the role that it plays in improving quality of life and even the prospects of longer-term survival. We are blessed not only to have all of you here tonight, but to also have Dr. David Spiegel, who is really, as Jamie Seller, our clinical director, said, a rock star in the world of cancer research, and Todd Stoudemire, who is a rock star in many ways. The Institute of Medicine, established by the National Academies of Science, an advisor to the federal government on matters pertaining to the health of the public in a 2008 report, Cancer Care for the Whole Patient, stated that it is no longer possible to deliver good quality cancer care without addressing patients' psychosocial health needs. All patients with cancer and their families should expect and receive cancer care that includes appropriate psychosocial health services. The Spirit of Science, Science of Spirit, is an answer to that call. I have to say that having been at the wellness community for 8 years and having worked with all of the academic research and hospitals with a focus on cancer, that it gave me tremendous optimism that all of the hospitals and academic and research organizations with a focus on cancer united behind this evening and the 3 additional lectures that will be in this series. And this unique display of unity shows a commitment to psychosocial support and, more importantly, to you as individuals whose lives have been touched by cancer. And because I feel that they should be acknowledged, and because I do think that this is a wave of the future, I am going to take the time to read them to you. ASU College of Nursing and Health Innovation, Arizona Cancer Coalition, Banner MD Anderson, Cancer Treatment Centers of America, Chandler Regional Medical Center, John C. Lincoln Breast Health and Research Center, Maricopa Integrated Health System, Mayo Clinic, Mercy Gilbert Medical Center, Phoenix Children's Hospital, Virginia G. Piper Cancer Center, Scottsdale Healthcare, Comprehensive Cancer Center at St. Joe's Hospital and Medical Center, TGen, University of Arizona College of Medicine, and University of Arizona Cancer Center. It is with these individual academic research and cancer-focused healthcare institutions that the wellness community is very honored to partner to provide psychosocial support for you. We also want to thank our sponsors, Northern Trust Bank and Plaza Companies, and the TWC Wellness Community Leadership Council, which is a volunteer group that helps raise awareness of and funds for the wellness community. The format for this evening is as follows. I'm going to introduce Jamie, and he will introduce Dr. Spiegel. Dr. Spiegel will speak for 45 minutes. At the conclusion of Dr. Spiegel's remarks, Todd will tell how cancer has touched his family and his story of hope and courage and strength. At the conclusion of Todd's remarks, Dr. Spiegel and Jamie will come to the front and they will take the questions that will be completed at the conclusion of Dr. Spiegel's remarks and respond to your questions. So I'd like to introduce Jamie Seller, who is the Clinical Director at the Wellness Community. Thank you.
And I think Paula is a rock star as well. We'll just go ahead and get on that bandwagon. You know, when I did my interview for the program director position 4.5 years ago, Paula kind of had a side remark, and she said, the wellness community is the best kept secret in Phoenix. When she offered me the position, it was basically with the expectation that we would be working tirelessly to kind of erase the fact that we are a secret and get the word out about psychosocial support that the wellness community offers. So it's been about 4.5 years. When I started, we were the Wellness Community of Central Arizona. We're now the Wellness Community of Arizona, so we've expanded our service area. We had about 5,400 visits in a year. Last year we had over 14,000 visits. And now we work with pretty much every hospital in town we've got a relationship with to ensure that nobody in Arizona has to go through their cancer journey alone. But it still may not be enough. And while the wellness community is coming out of the fact that people do not know about us, that we're a secret, really one of the secrets still out there is the connection between the mind and body, specifically how it relates to people who are dealing with their cancer at this given time. So out of that, the spirit of science, science of spirit process or concept was born. Paula asked me early on, who should we get, who should be the person that's going to be able to spread this message? And what I said instantaneously was, it's got to be Dr. David Spiegel. I didn't even want to think of who Plan B or who Plan C would be until I got a firm no, not just a no, but a firm no. And when he didn't say no, but instead said when, we decided we needed a bigger room because we probably couldn't house this at the wellness community. What I want to do is I'm going to introduce Dr. Spiegel here in a second, but what I want to make sure is that everybody knows that on your chair should be a index card and a pencil. As Dr. Spiegel is doing his presentation, if you have questions, and I think you probably will, go ahead and start to write them down, because at some point after his talk, we're going to go ahead and gather those. And this is really what we're going to kind of go on for our question and answer period. You know, we kind of had not 400 RSVPs today, so we want to kind of keep it a little bit orderly. So let me go ahead and introduce Dr. Spiegel. Dr. Spiegel is a Harvard-trained physician specializing in psychiatry. He's currently the Wilson Professor at Stanford School of Medicine. He's also the Associate Chair at Stanford for the University School of Medicine and Psychiatry and Behavioral Science. He's a tenured Professor of Psychiatry and Behavioral Health Sciences. He's the author of hundreds of published pieces. He's a pioneer in the field of mind-body medicine. His early works on the benefits of emotional support for cancer survivors helped fuel a mass push in the field, which has culminated in that IOM report that Paula was talking about earlier. And really, the research that he has done has helped make the wellness community the program that it is today by really understanding the evidence behind what we do, why we do, and how we do. So without further ado, Dr. David Spiegel.
Thank you very much, Jamie and Paula, and it's a privilege and an honor to be here. I'm happy to do so. And there are healing factors in community, and this room is one illustration of that, and I hope by the end of my remarks to have given you some of the science as well as the spirit behind that statement. First, however, I want to mention that one of the reasons that I'm here tonight, other than my admiration for the wellness community and the work that you do, is to dedicate this talk and honor the memory of my sister, Dr. Ann Spiegel. Ann was a pediatrician here in Phoenix for many, many years, and sadly she died of cancer just about a year ago, in March of last year. She got tremendous help and support from the wellness community, and I'm very grateful to the wellness community for the support they gave her. Annie was a strong, vibrant woman who loved her work, was wonderful with her patients, loved her family. And she was the only non-psychiatrist in our family. Both of my parents were psychiatrists, and Annie told me that one day I would grow up and discover that I wanted to be a real doctor. But she went and married a psychiatrist. and I'm going to introduce you to him in a minute. So I express my thanks to the wellness community. She was part of the support group program, went and did yoga there very often, and the program was a tremendous emotional support for her. I want to introduce Dr. Jim Clark, who was married to Ann, and her daughter Lisa Clark, who is here as well. Could you both stand? And I've asked Jim to make a few comments about Ann. So Jim, would you come up, please?
I appreciate the opportunity to be here today to celebrate the Wellness Center and its role as outreach to the community in terms of cancer support and cancer education. Also, looking forward to David's presentation. I think that you'll see that David has a brilliant and curious mind, and he has much to tell us that's going to be important on the emotional and social interventions for cancer patients and how that can affect quality of life. My familiarity with the Wellness Center began because of my wife Ann's illness with cancer. Ann attended support groups on a regular basis, and with our daughter Lisa attended yoga classes. At the Wellness Center, she found solace, compassion, support, understanding, and an outlet for dealing with an illness that really turned our lives upside down. I wanted you to know that Ann was a tremendous wife, mother, daughter, and sister. She was a great friend to those who knew her. Ann was a pediatrician, and to her young patients and their parents, she rendered uncommon care and concern. And this is attested to from the comments that were put in her guest book after her death. I feel fortunate to have been involved in my wife's life and feel in many ways that my life made sense next to her. It's been through the support of family and friends that I've been able to go forward and deal with her loss. I think that the aspect of the wellness community that is a community is important. A community, I think, helps provide support and helps one go forward. I appreciate that the Wellness Center is going to plant a tree in Ann's memory, and I want to see the wellness community thrive and go forward in its important role in education.
Thank you.
Thank you.
Thank you very much. And I just, to be fair, want to introduce you also to Julie, their other daughter, who is an attorney in St. Paul, Minnesota. As we all know all too well, cancer is a stressor of many kinds. This dressmaker's maquette was prepared by a patient who gave me her name, permission to use her name before she died, Maurice Jaffe. She had been a Silicon Valley engineer, and I saw her at Stanford Hospital one day when she had been diagnosed with recurrence, and she said, you know, I don't want to die not having done what I always wanted to do with my life. So she quit her job as an engineer, and she became an artist. She went to art school and was teaching art by the time she died. And she walked into the support group with this life-size model of what had been done to her body by cancer and its treatment. And so you can see that she had a modified radical mastectomy, a tram flap reconstruction, radiation burns, biopsy, scar on the other side. And it's a reminder that many of you know all too well that cancer is not one big stress, it's a whole series of little ones that don't go away, and you're reminded of them every day. So what we need to do is help people deal with the stress in such a way that they face it, but don't let it limit them any more than it has to. What I want to do is talk with you tonight about stress and depression in cancer, psychotherapeutic treatments that we've developed to help cancer patients look at effects on outcome and effects on survival time, and what some of the mind-body connections might be that could link good emotional support to better survival. There's growing interest in techniques, many of which I hear are being used in the hospitals around here, mindfulness-based stress reduction, hypnosis, group therapy, to help patients deal better with the stress of cancer. The good news about cancer is that we are converting it from what used to be thought of as a terminal illness to a chronic illness. More than half of all people diagnosed with cancer will live to die of something else. That's the good news. The bad news is that no matter what we do in medicine, the death rate will always be 1 per person. So sooner or later, something will get us all. But people are living longer and better with cancer. In 1971, there were 3 million cancer survivors in the United States. This year, there are 12 million cancer survivors. So that's a tremendous victory for all of us working to help make cancer an illness one can live with. And the IOM report that Paula mentioned said in particular, this is the Institute of Medicine of the National Academy of Sciences, that addressing psychosocial needs should be an integral part of quality cancer care. And that's what the wellness community and other programs like it are all about. So the stressors people face with cancer are a whole variety of stressors, ranging from the existential question, because even though cancer is becoming a more and more treatable and curable illness, everybody diagnosed with it thinks it's going to kill them. It's the first thing they think. So there's that fear about dying. There are very important treatment decisions. There are changes in social life. You know, if you think about living the life of a cancer patient, even if you didn't have cancer, it would have a pronounced effect. You know, you're pulled away from the things that you like doing, your friends, the work that makes you feel valuable, and you spend a lot of time in waiting rooms reading stale magazines and corresponding with insurance companies. That's not a wonderful life pattern just by itself. So that, on top of the illness, means there are many stressors that come with the disease. I had a French cancer patient who was very troubled about losing her hair, and she decided to depict herself with the word cancer means crab, and it's considered a crab-like growth in the body. So she decided that her hair had been replaced by the crab, and she was going to do something with it. She said the villain crab goes on the attack, and one of the things that's unique about cancer is, you know, it's one thing if your kidneys or your liver or your heart aren't working as well, they're kind of letting you down. But cancer is different because a part of your body becomes the enemy. And so people have to kind of come to terms with a part of their body that has turned on it, and this is her way of depicting it. She also said the treatment is long and difficult to undergo. And one of the other strange things about cancer is that for many patients, the treatment is worse than the disease. You know, if you don't feel particularly bad, you may have a lump or a little bleeding or something, and the doctor's words turn that into a life threat. And then the treatments have been described by Dr. Susan Love as slash, poison, and burn. You know, that they're very difficult and arduous treatments. And so the treatment feels like a punishment. And that's one of the things we have to help cancer patients and their doctors come to terms with. There's also a great sadness that goes with cancer, of course. There are people who are very sad, understandably, and there are some who actually go beyond sadness to get depressed. The rate of depression, and depression is not ordinary sadness. Depression is feeling hopeless, helpless, and worthless. It's feeling like there's no point in going on, you have no energy, you're not worth the trouble. And this interferes with people's ability to get the treatment they need. And one little clinical tip is, you know, if you're, that I will pass on as a psychiatrist, is if you're with someone who's anxious, how do you usually feel? What does an anxious person make you feel like? Yeah, you feel anxious too, right? They're nervous, you're nervous. The guy behind me on the plane coming out here was tapping his foot on the floor all the time. It made me anxious, you know. But if you're with someone who's depressed, how do you usually feel? Depressed is not the first choice on this short answer test. What else might you feel? Anger, yes. Whoever said that, you got it. Depressed people tend to make you angry. You want to shake them by the neck and say, come on, it's not that bad. And if you could shake them out of it, they would have been shaken out of it. It doesn't work. So I just ask you to consider, if you find yourself getting angry at somebody, ask yourself, and you don't know why, ask yourself the question, maybe are they depressed? Because it's easy to overlook depression. You could say, well, of course she's feeling hopeless, she's got a bad prognosis. Of course she's not sleeping, she's worried about her disease. Of course she's not eating, she's getting chemotherapy and she's nauseated. But those can also be symptoms of depression. And depression is a highly treatable illness. Depression causes more disability than any medical illness in the United States. More days off work, more lost time to depression than any other illness. And it's highly treatable, but we often overlook it. In fact, depression also complicates the outcome with cancer. So 19 of 24 studies show that depressed cancer patients actually don't live as long as patients with the same kind of cancer who are not depressed. So depression is a risk factor for cancer, and it means it needs to be treated. We just published this study in the Journal of Clinical Oncology a few months ago. We looked at the course of depression in a group of patients with advanced breast cancer. And what we found was the ones whose depression were getting worse in the initial year, that's way over on the left, did not live as long as those whose depression was getting better. And it didn't mean that you got really depressed 2 months before you died with cancer. It meant years later. So it's very important to identify risk factors. And if people are telling you that they just don't feel they're worth anything, they're just a burden to everybody, that's the time to get them help. We had one woman in one of our support groups who, she was a remarkable woman. She had perfectly matched accessories at all times, even when she was very sick. She came in looking absolutely stunning. And she said, you know, my husband is a banker, but he's not a teller. He doesn't talk. And I think, I think he's about had it with me, and it's time for me to find a way to end my life. And, you know, one of the rules of us group therapists is you bring it in the room. You don't talk about people who aren't there, you talk about what's happening in the room. So I said to her, I wonder if you're asking us a question. Have we had it with you? Are we tired of seeing you here? And she got powerful feedback from the other group members about how important she was to them, how much they admired the way she stood up to the cancer. And she died about 6 weeks later. She didn't end her life, but there was a provision in her will. She sent a limousine to the building where our group meets in the psychiatry department and drove everybody to her memorial service and had us speak at the service. So clearly that meant something to her. So addressing these issues directly can be tremendously helpful to patients. The average difference that depression made in survival in this study was 2 years. So the ones whose depression was getting a lot worse tended to die 2 years sooner than those whose depression was improving. So it's very important to treat it. So what can we do to treat depression? There are a lot of things we can do. There are psychopharmacologic treatments and medications that work. There are kinds of group therapy like the groups that go on at the wellness community. I understand you have 10 a week of support groups at the wellness community, and then monthly meetings for about 10 other different kinds of cancer that are more educational. It's a wonderful program, and it can be tremendously helpful for depression. So both psychotherapy and meds. Oh, I did the wrong thing here. Ah, good, there we go. This is the psychopharmacology slide here. It's to tell you that antidepressants work. This is the New Jersey Turnpike, I think, with the new governor who takes helicopters everywhere. Woody Allen once said that it's sobering to realize that the light at the end of the tunnel is New Jersey. So my main point, I have 2 points about medication, and then I'm going to go on to psychotherapy. Antidepressants work. They can be very helpful. More than half of all people given antidepressants will show significant improvement in their depression. But talk to your doctor about it, especially if you have breast cancer, because there are some antidepressants that can interfere with some of the hormonal treatments that you take. So some don't, and they're perfectly safe, but it's very important to review with your doctors whether the kind of antidepressant that you might be taking could interfere, particularly with use of tamoxifen, the estrogen response modifier. So it's a fixable problem, but one that is important to pay attention to, and antidepressants work. What I'm going to do is talk to you about what we call supportive expressive group therapy. It's a kind of treatment that can be very helpful for people undergoing, experiencing cancer. And there are 7 themes that we discuss in these groups, and I'm sure it's very similar to what Jamie and others do at the wellness community. The first is building bonds. You know, I'm sure you've noticed. How many of you are cancer survivors here? Ah, just a couple, huh? How many of you found that you lost some friends when you were diagnosed with cancer? A lot of them. How many of you made some new friends when you were diagnosed with cancer? Good. Even more hands went up. That's good. Friendships, what happens with social relationships when you get cancer is some get better and some get worse. They rarely stay the same. So some people can deal with it and are wonderfully helpful and others can't. But you change because suddenly you feel like the outsider, right? You know, that you've got this horrible C thing going on and the rest of the world is perfectly normal. And there are many people who reinforce that belief by being afraid to talk about it because they're anxious themselves, because they don't want to upset you as though you don't think about it all the time. And, or even worse, not just the C word, but the D word. So a lot of social relationships get worse. And it is therapeutic to find places where you can make new networks of social support. And the wellness community is a perfect example of that, because the very thing that makes you feel odd in the rest of the world is your ticket of admission. to places like wellness, and you feel normal again, because everybody's got the problem. So now what do we do about it? There's another thing that happens, and that is, we call it the helper therapy principle. Let me see if my next slide, no, I'll be there in a minute. That there's nothing good about getting cancer, but if you can use your experience with it to help someone else with the same illness, then something really genuinely good has come out of a bad situation. And many of our patients come to feel like experts in living. They can really help people live better with cancer, and they feel better about themselves for doing it. So building new networks of social support, that's why we call it supportive expressive group therapy, is very important. Expressing emotion is important. One of my patients told us a story. She said, I started to cry, and my husband said, don't cry, you'll make the cancer spread. Now, it's a good thing he wasn't in the room at the time. He wouldn't have gotten out alive, I think. But there is a popular misconception that giving vent to anger, fear, or sadness about cancer means you're giving in to the cancer. And nothing could be farther from the truth. Putting on a happy face does not help you. We have these emotions for a reason. You know, I tell the medical students and residents at Stanford, if you see a patient crying, don't just do something, stand there. These emotions are there for a reason, and we often treat crying as if it were bleeding. You know, any Boy Scouts here, you know what to do if someone's bleeding? You apply direct pressure until it stops. And that's what we tend to do when people are understandably upset about having cancer. But giving vent to these emotions helps people deal with them and move beyond them. And so our goal here is to convert anxiety into fear and depression into sadness, because when you're afraid of something, you know what it is, and you can begin to think about what to do about it. Similarly, if you're sad about something, and you can know what to do about that. If you're just feeling anxious or depressed, you're miserable, but there's no obvious path of active response. And that's what we try to help patients do. Thomas Jefferson said, when angry, count 10. If very angry, count 100. Mark Twain said, when angry, count to 4. If very angry, swear. And I'm on the side of Mark Twain on this one. We think it's very important that people not back away, but use emotion as a source of closeness, of intimacy. And this goes for family members too. That there's nothing wrong with talking about your own anger, fear, and sadness about the disease. You know, parents often say about kids, I don't want to upset them. Well, you know what? The kids are upset. They know something's wrong. And if you don't talk about it openly, you isolate them. And children often think, you know, what did I do wrong? Why are the parents upset? I must have done something wrong. And the more they feel excluded, the more certain they are they've done something wrong. So then what they do is they start acting up to give themselves a reason why it's all happening, and then you get angry at the kids for acting out, and really they're distracting you from your own misery, and it's a bad cycle. So instead, finding ways to be open and clear about how you feel is helpful. That's the expressive part of the supportive expressive group therapy. Shakespeare, of course, said it best. He said, give sorrow words, the grief that does not speak, whispers the oft-wrought heart, and bids it break. I want to show you an example of how members in our group dealt with the first death of someone in the group. Because when we started this program more than 30 years ago, Irv Yalom, who's written some wonderful books, including one on dying that is very helpful called Staring at the Sun, invited me to co-lead a group of women who were dying of breast cancer. And he was the world's authority on group therapy. I thought for a second and a half and said yes. And it changed the course of my life and my career. But we were very worried that putting women together, some of whom were going to die within a finite period of time, would demoralize them. And so we watched it very carefully, and I want you to watch how these women are dealing with the first death that they saw. Oops, it didn't work. I think, can you put the arrow on it and just press the, yeah, now just press.
I'm wondering if we've got a few minutes left. If we could each take a minute to think about what would I want to get from the group before it's over today. Test the waters a little more. Well, what do I want? Because it's hard in here, I can imagine it's really hard outside.
My main objective was to come in and help someone else regain hope, because you can get through it.
I'd like to make sure that what I do, what I decide to do with treatment and things for cancer is the best thing to do.
Gerald called me after I didn't show up last week, and somebody cares that I wasn't feeling well.
Call it yourself, too.
Yeah. And I think that that's what I want from this group, is to find people who are supportive and caring about me.
What do you want?
I didn't really come wanting anything. I just volunteered for the study, and here I am.
We all know people like that.
Our October 2nd meeting was sweet and sad. The members were dealing in a more palpable way than they had previously with fears of dying. Debbie talked about planning her trip to Hawaii and how much she was looking forward to it, and at the same time, she knew that this would likely be her very last trip. This is October 30th, 1991. It was a pivotal meeting for the group because it was the first meeting after Debbie had died. Clearly, the group was challenged to face what they most feared and emerge either feeling closer and more supported or demoralized.
I mean, do we know anything?
That's what I was going to say. What happened to
What
Debbie?
happened?
I'd like to know what happened.
What do we know?
My understanding is that she got some fluid in her lungs and that a decision was made not to be extremely aggressive in trying to treat that. They felt that the prognosis was not good.
I'm angry that I don't have a chance to say goodbye. I mean, it just feels so abrupt.
Yeah.
And we weren't able to do anything, not knowing.
Yeah. How does that, you would have wanted to be able to?
Yeah. Well, at least
I would have, yeah.
somebody
Yeah,
flowers.
something.
Yeah. The issue that I hear everyone talking about is lack of predictability. In the sense that here was Debbie talking about her trip to Hawaii, and now she's not with us.
There was a big bubble there of euphoria for her, and it was gone, and it wasn't a bubble, it was a big deep hole.
Better. Wish I had known her before cancer. I keep thinking, what was she like before? You know, because we never really knew the real Debbie, because she said that that wasn't the real Debbie.
I invested in her. I had feelings for her.
Can you tell us about the feeling? Yeah.
I would have liked to think about it. Something.
Well, what would you say to her?
Not to worry. And not to fear. And to have somebody there to tell you that. And just share with her that it's okay and that our family will be okay. They will be all right. And not for her to feel that guilty for being sick and guilty for dying on them. And they will continue. And
What you're doing in that group is marching death right there in the center of that circle and forcing those women to look at it. They can't turn their eyes away from it. You're rubbing their nose in it.
That's Bill Moyers. He has such a gentle way of asking questions. He told me that journalists are people who explain things they don't understand, which I sort of like. But he's right. We were. And yet I think you can see that these women are not shrinking from death. But what aspect of the death were they focusing on? Any thoughts about that? The suddenness of it. And so what they were beginning to do, that's right, is think about better ways to die. If we can't do anything about the fact that we die, but we can do a lot about how we die and how we live before we die. And that's what they were focusing on. And you notice that Sheila, as she was crying, and we just let her cry, was comforting herself. And she was saying how she would have reassured Debbie in the face of her death, and was providing her own comfort as well. So facing this issue strengthens people, it doesn't weaken them. And I'll show you an example of that. Madeline, a member of another group, when one of our members died, made these little cards that she handed out to members of the group. Dear Eva, whenever the wind is from the sea, salty and strong, you are here. Remember your zest for hilltops and the sturdy surf of your laughter gentles my grief at your going and tempers the thought of my own. So patients actually found comfort, and one way that they did was seeing death not just from the perspective of identifying with the person who was dying, but of the people who have to grieve the loss, of their family and friends who are worried about their death. So they experience it from the other point of view as well, and they find that that strengthens them. Another woman, Emily, said that being in the group is like being at the top of a tall building or at the edge of the Grand Canyon in your state here. She said, at first you're afraid to look down. I don't like heights, but gradually you learn to do it. You can see that falling down would be a disaster, but you feel better about yourself because you're able to look. That's how I feel about death. I can't say I feel serene, but I can look at it. And that's how we try to help people deal even with the worst possible outcome. However, not everybody gets it. He's saying, I'm sorry, Mr. Rainey, our test show, you have 2 weeks to live. He says, can I take them in August? Or in Phoenix, I think he'd say, can I take them in December, right? But people use it as an occasion to change their life priorities, to live differently, to quit their job and spend more time with their family, to finish a project or a book, or like Maurice, to become something different, to become an artist. And that's a valuable thing to do. Cancer afflicts families as well as patients, and we've had support groups for family members. I'd say the major thing there is that family members often don't feel like they have the right to feel bad, because I'm not the one with the cancer. And one of the husbands came in and said one day, you know, this is the place where I come to feel better about feeling bad, that I have a right to feel bad too. Patients, as I mentioned, often feel punished by their doctors, and we encourage them to develop clear, open communication with physicians, but there are things that interfere. I'm sorry, Mr. McConnell, your insurance plan only pays for empathetic nodding and a sad and downward glance. There's a $200 copay for any additional words of compassion, not to exceed 40 words or 3 expressions of sympathy or condolence. And all I can tell you is, I wish this were funny. You know what the health insurers have in common with a hospital gown? Neither one is likely to cover your ass. That's And you know, I am so troubled by what's happened in our healthcare non-system in this country. It's the most expensive in the world, and we don't by any means have the best healthcare in the world. And there's just one fact I'd like you to think about, and that is the hated, supposedly inefficient, big government Medicare system. Do you know what the overhead cost in our Medicare system is? 2.7%. That means $97.30 of every $100 in the Medicare system pay for medical care. They pay for doctors, nurses, psychologists to deliver care. You know what it is in the private healthcare system, the overhead? 27%. So Medicare is 10 times more efficient than private insurance. We spend more money on private insurance in this country than we do on doctors. We spend only 25% on doctors. So we could fix the healthcare system tomorrow by getting rid of private insurance in healthcare. It's a waste of money, and they have no business in healthcare. So I hope we're going to make a change, because the system is broken. And you know, the leading cause of bankruptcy in the United States is healthcare costs. It's the #1 cause. In Europe, which has government-sponsored health insurance, there is no bankruptcy for healthcare. None. Doesn't happen at all. So we really need to rethink what we're doing in healthcare in this country. Back to doctors, something we can do something about. Yes? Nothing like your health insurance premiums and what your employers are paying for it. You're wasting 25 cents of every dollar in your private healthcare premiums and in what your employer is paying for it. And our products are uncompetitive in the world because General Motors spends more money on health insurance than it does on building cars, on steel and cars. So the waste is much greater in the private system than in the public system, much greater. So there are 3 things people need to do with their docs: communication, control, and caring. Communicate clearly and get answers to your questions, participate in treatment decisions, and we encourage patients and groups to do this, to share decision-making with their docs when that's appropriate, and to find docs who care about them and care about what they're doing. So those 3 C's can make for far better health care, and programs like Wellness can help encourage patients to be more active in their role as patients. Well, do these groups help people? This is one uncommon side effect. He's saying, what were you feeling before you ate the other members of the group? It's a rare side effect. We don't see it. What we see more commonly is that the women, we do randomized clinical trials, just like people do for chemotherapy. We randomly assign women to either get standard care or standard care plus participation in our support groups. And we do it that way so that we know if there are any differences, it's due to the treatment, not to the type of people who would choose to get the treatment. And what you see here in the yellow line is that the distress of the women randomly assigned to our supportive expressive groups declines over the year. The green line is those in the control condition, and they get worse. So even though they're confronting people who, some of whom are dying of the same disease, they wind up less anxious and depressed. And we repeated that finding in a whole new sample. And when I say we repeat a study, our studies take 15 years. It's a big deal. And we were able to find the same kind of thing. I'm glad to report, you probably can't read this, but this is from what's called a Cochrane database review. This is a very tough and critical analysis of the results of medical trials. And what it shows is that treating depression among advanced cancer patients is very effective. And they would be happy to say it wasn't, because normally they're very critical of medical results. And I'm glad to say that our trial was one of the ones that they included. So what about effects on the body? When I started this work in the 1970s, I was pretty skeptical that helping people, I was all in favor of helping people emotionally, but I was pretty skeptical that it could have any effect on the course of disease. And there were people, including Carl Simonton, who had a ranch down here somewhere, who was teaching cancer patients to visualize their white cells killing their cancer cells. And I didn't think it would have any effect on cancer. I still don't. It's an interesting idea, but what it can do is make people feel guilty if their cancer progresses. I didn't visualize well enough. So we found out what happened to the women in our initial psychotherapy trial. And much to our surprise, the women who were randomly assigned to get our group therapy lived significantly longer, 18 months longer on average than women who got standard care. So that lower line that you see there, over here on the left above the 40, is the mortality of women in the control sample. And by 4 years after the trial began, all of the control patients had died. A third of the treatment group were still alive. Now, all but 2 of these women did eventually die of breast cancer. This trial was done in the 1970s. But there was a significant difference in survival, which was very surprising to us. We published this in The Lancet, which is one of the leading medical journals, and it got a lot of attention. We then did one of these 15-year replications. Now, in this new trial, supportive expressive group therapy again, we did not find the same overall treatment effect, but we did in one group of breast cancer patients, those with estrogen receptor negative tumors. They tend to have a more serious prognosis, and that's the red lines there. And so the dotted lines are the ones who did not get group therapy. The solid red line is the ones who did. They lived longer. Now, why would it be different 15, 20 years later? Well, one reason is that our treatments for breast cancer have gotten a whole lot better. And the treatments include hormonal treatments that were not available at the time. The thing is that the ER-negative patients don't benefit from the hormonal treatments. Only the ER-positive women do. So we think that the hormonal treatments provided the kind of help and survival that our group therapy had before, but the ER-negative women could not benefit from that. This just shows how mortality has declined in breast cancer over the period of the last 3 decades. Now, I understand that you're going to have Barbara Anderson come speak here in the spring. She's an excellent researcher at The Ohio State University. Barbara ran a clinical trial of women with breast cancer using an intervention that had very similar themes to ours, but is more educational in nature, but the same basic idea. And she just published the same thing, that she found that women who were randomly assigned to get this group therapy lived longer, had fewer relapses, and lived longer than patients who got just standard care. So it's the difference between the dotted lines and the black lines. The black lines are the ones who got treatment. And this is a 10-year follow-up that she published. So it's an independent study showing that emotional support has a difference, an effect on survival. And perhaps most interesting, and surprising even to me, is that last August in the New England Journal of Medicine, there was a randomized trial of palliative care. Palliative care is a very important part of medical treatment where you focus on comfort, on controlling pain, controlling depression and anxiety, and you tend to cut back on the aggressive chemotherapy with cancer treatment. These were patients with non-small cell lung cancer. And what they found was that they reduced the depression by more than half. That's the two columns on the left there. So they were less depressed when they had these palliative care intervention. But the patients who got this intervention also lived longer. So the upper right line there, who had early palliative care, lived an average of 2.5 months longer than those who had standard care. Now, 2.5 months may not seem like a whole lot, but frankly, when you get that difference in a chemotherapy trial, drug companies are very excited. And these were people with end-stage lung cancer, so their prognosis was very bad, and yet psychological intervention made a difference in survival. And I think that's been one of the most surprising and interesting things that I found in the course of my research on this. That is, the biggest effects seem to be when we're running out of tricks medically, when we've run out of chemotherapy or radiotherapy interventions that are likely to affect disease progression. I think what we're doing is tapping into the body's own stress response systems. And so what I want to conclude with is a few observations about what we think is going on in the body that may allow psychosocial intervention to affect disease progression. I'll just mention that there are now 7 clinical trials that show that emotional support actually affects survival with cancers of various kinds and some pretty aggressive cancers like malignant melanoma, gastrointestinal cancers, as well as breast cancer. 7 published clinical trials. There are 6 others that attempted to ask this question but found no difference in outcome. 4 of them were in breast cancer. In 3 of them, there was no emotional benefit from the intervention, so it's hard to imagine that it would affect survival time. In the 4th, the Goodwin study, it was a pretty well-conducted study, except that for some reason, the intervention group, the women who were randomly assigned to get the psychotherapy, were significantly more depressed to begin with than the control patients. So there was something funny about the randomization that worries me about that study. The main point of this is that even in end-stage cancer, emotional support may not only improve quality of life, but it may extend quantity of life as well. And the studies are not random. There isn't a single study that shows that psychotherapy kills patients, I'm glad to report. So they either show no difference or an improvement. It's an area where we need more research, but I think the results are pretty promising right now. So how does it work? Well, we have a number of stress response systems in our body, and I won't give you the first-year medical psychophysiology lecture, but I'll just say that 2 big stress response systems involve one, cortisol. Cortisol is a hormone that's secreted by the adrenal glands, which sit on top of your kidneys, and it basically elevates blood sugar. So it prepares you to fight or flee. And it's meant to turn on when you're stressed and turn off when you're not. As you know from this morning, waking up is a daily stress task, all right? And your cortisol levels should be about as high as they're going to be when you wake up in the morning. Mine certainly were this morning. It's the blue line there. But by now, your cortisol levels should be 1/4 as high. So we have this nice daily variation in cortisol that gets our body going in the morning and then helps it tone itself down toward the end of the day. But we found that many advanced breast cancer patients have abnormal patterns of cortisol, the red lines rather than the blue line, in which it goes up later in the day rather than coming down. And what we found was that predicts shorter survival with breast cancer as well. So having a disrupted stress response system can actually hasten the progression of breast cancer. And this has been shown not just with breast cancer now, but with lung cancer as well, by a colleague of mine, Sandra Sefton, who's at the University of Louisville. So having an abnormal stress response system may actually be a risk factor for more rapid cancer progression. And this is independent of all the usual risk factors that predict mortality with cancer. So we think that the hormone stress response system, the immune system also, which I'll talk about briefly, can have effects on one another and can affect the progression of cancer. This is a study that showed, you've heard of BRCA1, BRCA1, it's the breast cancer risk gene. And what this gene does, it's called a programmed cell death gene. It's an oncogene that when cells start to transform, basically gets them to commit suicide. So it's a very useful gene to keep malignant cells from proliferating. If you have a mutation to that gene, your risk of getting breast cancer goes from about 8 or 9% to 86%. So it's a big deal gene in breast cancer. Most breast cancer doesn't have this abnormality. But what this study showed is that if you put cortisol on the normal BRCA gene, that you inhibit its secretion, so it doesn't work as well. And that suggests that abnormal stress hormones may inhibit the very genes that help our bodies to control breast cancer progression. We also see that depression can interfere with other aspects of immune function. So this was a study in which we rubbed something like poison ivy on the skin and looked at the degree of immune response. And patients who had these abnormal cortisol patterns or who were depressed had less of an immune response. We know, for example, if any of you have autoimmune disease like arthritis, sometimes you take corticosteroids as a treatment. So our own stress hormones are also anti-inflammatory, and if you have too much of them, you may be inhibiting your immune system's ability to fight the cancer. One type of immune cell that does that is called a natural killer cell. These are cells that don't look for antigens, so they don't kill bacteria that invade the body. They look for transformed cells like cancer cells and kill them. And we found that the women with these abnormal cortisol patterns had fewer of these natural killer cells, so they were at greater risk from that point of view too. So these stress hormones affect our immune system, and that can impair the body's ability to fight the progression of the cancer. And finally, there's another stress hormone called norepinephrine. It causes your heart rate and your blood pressure to go up when you're stressed. And that hormone, in this study, can trigger the growth of blood vessels in the body that would support the development of metastatic tumors. And if you block those hormones, you can block the growth of these blood vessels. So there are many ways in which stressors can make it easier for tumors to grow, and stress control can help the body block the progression of tumors. One final thing that's very important, and I tell my cancer patients, I met a very nice gentleman here earlier before the meeting who said one of the things he did was he went right back to work. He said the only reason he wore a wig is so that his clients wouldn't waste time while he was counseling them about their legal problems to talk about what was going on with his health and his body. But he kept working. He played tennis through his chemotherapy, and he, I think, is 19 years after his chemotherapy and is doing great. Being active and getting plenty of sleep, eat well, sleep well, get plenty of exercise helps. These abnormal cortisol patterns are related to sleep disruption as well. And we have evidence that poor sleep patterns is also associated with shorter survival with cancer. So getting good sleep is it's like you're in training, you know, and we'll hear from Mr. Stottlemyre about what you do as an athlete when you train. But in a sense, cancer patients are in a similar situation. When you're dealing with cancer, you want to be in training to help your body do the best it can to fight the disease. And we found that people who sleep well also are better able to control what we call their vagal tone, the parasympathetic nervous system that helps to soothe us. And you all know that if you've had a bad night's sleep, even the minor things the next day will really get to you. And so sleeping well can help you manage those stressors better also. So we think that the way people handle stress and the amount of emotional and social support they get can have an effect on the way their body copes, the stress hormones in their body, the immune system, that can have effects on the way the body can cope with the progression of cancer. We hope that we help patients transform themselves from feeling damaged and stressed by the disease to transcending it. The image on the right is the Winged Victory of Samothrace in the Louvre. It's a magnificent sculpture, and when you walk up to it, you don't say, my, there's a woman who's missing her arms and her head. You see it as an image of power and transcendence, and that's what we hope patients will do. The acronym that I ask people to remember is FACES. Face rather than flee. Deal with the stressors that are in front of you. Alter your perception of your situation. Change your priorities in life. Cope actively. Find something you can do about whatever it is that's stressing you. Express emotion and seek social support. My French cancer patient, her hair had grown back. She said, you know, you have some better days. And she did the typical French thing that the French love to do with the crab. She made a meal of it. She barbecued the crab. She says, alors courage. And that's what you want to do. So psychotherapy works. Depression and psychotherapy affect disease progression. Feeling better may lead to healing better, so mind your body. This is our Center on Stress and Health. They're a wonderful group of people. I'm grateful to them and to the many patients over decades who have taught us so much about how they cope with the illness and how to help other people cope with the illness. I'm also very grateful to the support we've gotten from the National Institutes of Health. And by the way, the federal government is flatlining the NIH budget, which means real dollars are going down for healthcare research. That's a terrible mistake, not just for our health, not just for scientific knowledge, but because we are the world leaders in psychobiology and biological substances that can help treat all kinds of illnesses, and the National Institutes of Health are the seed of a huge amount of industry and growth that we can remain at the cutting edge of if we invest in it. So the NIH has been a tremendous help to me and to many of my colleagues in doing this work. National Cancer Institute, National Institute on Aging, National Institute of Mental Health, as well as California Breast Cancer Research Program and a number of foundations, and I'm very grateful to them. Shakespeare said, "When we our betters see bearing our woes, we scarcely think our miseries our foes. The mind much sufferance doth o'erskip when grief hath mates and bearing fellowship." So I commend you for your good fellowship, and I thank you.
So Rich is the chairman of the Phoenix office of Jen Spring, and actually was the first employee, and the assisted owner assisted Jerry Colangelo in securing the Major League baseball franchise for Arizona. He also was at the Arizona Diamondbacks, was the president of the Diamondbacks, yay, and built the arena and ballpark. So Rich, thank you so much, and please come on up.
I'm one of those cancer survivors. I'm one of the ones that went and got more friends after I got cancer. I went from one friend to two. And I was president of the world champion Arizona Diamondbacks. That sounds pretty impressive. I was also president of the team when we lost 100 games. This is really a thrill for me to get to introduce Todd Stottlemyre. You know, there's a lot of things we can talk about with Todd, but I want to just tell you just a few things. In my 20 years of getting to run the Suns and the Diamondbacks, I got to deal with a lot of great players. I get a little emotional when I talk about Todd. So, Gonzo, Barkley, Bell, Williams, Grace, Hornacek, Marley, some pretty good names, huh? Tom Chambers, Cedric Ceballos, Matt Williams. But let me tell you, the greatest guy that ever played for either of those teams was Todd Stottlemyre. You'll know why in a second, I promise you. There's three things when I think about Todd. There's three sets of words I think about. Number one, sincerity, passion, and a great father. When we signed him just before the 1999 season, I got a couple stories to go with that, but when we signed him, we were talking to Randy Johnson, trying to get Randy Johnson to sign with us also. And he said, you know, I'm not interested because I don't think you're going to be good enough in the next few years. And we said, okay, we got it. So we went and signed Todd Stottlemyre. The day that was announced, Randy picked up the phone, called, I'm ready. You're going to be good enough now. But the most impressive thing when we signed Todd was he made a commitment to our community to give $1 million to charity. $1 million. He gave it to the United Way. Pretty amazing. He was really the forefront of athletes giving money to charity in our community. He was literally the first or second one. And I think he's the only one who held firm to his commitment and gave every one of those $1 million to our community. Well, the boring stuff is he pitched 15 years in the big leagues, 5 teams, 5 times he started 30 games or more. He was an amazing player, and he would have pitched about 20 years the way he kept himself in shape, but he had every injury known to man from here to here. I remember one time he told me, he goes, I can't even brush my teeth. I can't get my right arm up that. He goes, I'm learning to go the other way now with my toothbrush. But some of the really most important things about Todd, he did not pitch one inning for us in the 2001 season. The World Series season, did not pitch one inning. But he was as big a player on that team as Gonzo, RJ, Schilling, Grace, who got to hit the lead off the bottom of the ninth. Every player would tell you he was the most respected player on that team. He was the cheerleader. He was the enforcer. He was the motivator. He helped us win that World Series. Something that I think is the most impressive, in 2000, year 2000, he was awarded 2 awards by Major League Baseball. One of them was the Branch Rickey Award, which is given to the player with exceptional community service throughout all of the baseball teams in Major League Baseball. That same year, he also was awarded the Lou Gehrig Award, which is given to a player with the most character and integrity, both on and off the field. You are in for a real treat tonight, I promise you. My mistake was today, I should have brought Kleenex, and you should have probably too. I'd like you to welcome Todd, and he's the best in the world, and he is a great father, great husband of Erica, and a great father of these 4 great kids. Please welcome Todd Stottlemyre.
Well, first of all, let me say that, Rich, you took me to my knees. Thank you. I can tell you that when I was a free agent after the '98 season, I had 7 other clubs with pretty similar offers on the table. And I remember getting a call to say that the Diamondbacks would like for you to take a visit. And I go, who's that? I go, look, that team has got 1 year under their belt, and they lost 100 games. Why would I go to Arizona? And I thought, why wouldn't I go see what's going on out in Arizona? And I thought that at the time, you know, maybe it'd be a nice vacation on the Diamondbacks. And I thought, I'd get a paid vacation to go to Arizona. That'll be pretty cool. And when I came out to Arizona for the visit and got to meet guys like Rich Dozier, Jerry Colangelo, Joe Garagiola Jr., don't we miss those 3 guys in this town? Now, it took me about 8 hours to realize I was at home. And because I seen a commitment to family, community, and I seen a commitment and a passion to win. And I thought, that's everything that I want. And I took a leap of faith, not having any idea what they were going to assemble. But I got to tell you this, I have never in my entire life experienced such class from an organization. And to have the friendships that I've developed from guys like Rich Dozier, because, you know, I don't hold a candle to these guys and their commitment to community and what he has done. See, my inspiration and my giving starts always at the top, and it starts with guys like Rich Dozier. If you ask Rich, he'd give you the shirt off his back. Jerry's the same way. They would find a way. They would always find a way. So, Rich, thank you. We love you, man. Now, Rich called me, and he says, Todd, I got a perfect fit for you. And I thought, uh-oh. And he told me about the wellness community. And I said, yes. And then I asked when and where and how and all those things. You know, here's what I'll tell you is that today I have a stage, a platform, not one I asked for, but one I'm proud of. You see, because our family has been fighting cancer for the last 35 years. And it really started back in the 70s. Back in the 70s, I had a little brother named Jason. And we're going to make it. And Jason got sick. And he was on the couch, and I can still picture him laying on the couch. And after 2 or 3 days of flu-like symptoms, as we thought, my parents took him to the doctor, and they ran some blood tests and ran several tests on him, and they had decided that he should go to Seattle and get further testing. So right before Christmas, back somewhere around 76, 77, where I was about 10 or 11 years old, he was my son's age, 5 or 6, and came home with my mother and father right before Christmas, and he was diagnosed with leukemia. Now, all that meant to me at the time was it wasn't the flu. Didn't really understand what leukemia was, nor did my mother and father. We just knew it was more than flu-like symptoms, and there was going to be treatments that were going to have to take place. Chemotherapy treatments, radiation treatments, spinal taps, medication, hair loss, all the things that a 6-year-old wants to go through, right? But you know, not one time did he complain, even though back in the 70s, the quality of life for a leukemia patient at the age of 6 was a living hell, but never complained. You see, would chase butterflies in the neighborhood, would bird watch, would play Little League baseball, YMCA basketball, play in the local soccer team, until the treatments got so severe that he couldn't. And he lost his hair. My mother bought him a wig. He refused to wear it because he was not ashamed. He wore a ball cap every day, used to rub his bald head, and the treatments got him into remission for about a year, and then a year later, Jason gets sick again, and the leukemia is back. Once again, same type of treatments, same process, same living hell, and but once again battled it. Once again, never complained, maintained his love for life. Matter of fact, every restaurant we went into had the little card, leukemia card, where you put the quarters in the slots. And there wasn't one time where my dad wasn't begged by Jason, pulling on the pant leg, "Dad, I need quarters," and would fill up every slot before he'd leave the restaurant. So back in remission for the second time, 18 months later, our friend leukemia is back. And this time, they decide that normal treatment, chemotherapy, spinal taps, radiation, all the great drugs, the body changes, the hair changes, it wouldn't work this time. They said that this time it might take something more severe for him to have any kind of quality of life. So they called for a bone marrow transplant. Now, they sat with my parents to go over what a bone marrow transplant meant, what it would be like, and they made that decision to go through with the bone marrow transplant. Now, all of us had to go take blood tests to see whose marrow was going to match. And I was the lucky one. Now, I say lucky one because it's created a stage to go speak and help other people, but it's also helped me rehabilitate. And my rehabilitation process has been part of that, what I call hell. You see, A bone marrow transplant works like this. They injected needles into my body. Now, look, I'm not complaining because I was asleep, obviously. In and out of my hips where they would extract the marrow. So, in and out maybe 700 to 1,500 different times. When I wake up, after, I couldn't even wiggle my toe because marrow was all gone from my system, basically. Now, of course, I bounced back quick. It only makes sense. I'm healthy. Marrow was then injected into Jason's body. And this was 1981. And after about a month, he was running around the hospital, smiling, laughing. It looked like a smashing success, where everybody in that hospital floor and on that ward, every child that had leukemia had passed. He looked like the lone survivor. And 2 days before he was released, he went into a coma. And the night before the coma, he asked that I would stay at the hospital with him. You see, he knew he was dying. He was 11 years old. But he attacked life like I'd never seen. With courage, with a no-quit attitude, with a love for every breath. And he never came out of the coma. 2 days later, he died. And I watched him take his last breath. And then I watched him turn blue because I wouldn't leave. And you want to talk about hate? I hated cancer. I hated leukemia. I hated our doctor. I hated life. I hated our Creator. I had no control. I had laid down, launched my marrow into his body, and ultimately, the rejection from his body, from my marrow, puts him in a different place. Now, I was 15 at the time, and I can tell you that it altered and changed my life forever. Number one, I never quit because he didn't either. Number two, I'm never backing down from anything, and sometimes that hasn't served me so well. But number three, he not only taught me how to live, he taught me how to die. And that's one breath at a time in a living dogfight. Now I know there's people in here with cancer. And here's what I can tell you. Whether you have it or don't have it, I want you to just think about the last breath you just took. See, you didn't even think about it. You didn't even think about the last breath. But you know what the last breath was that you just had? It was a gift. And we're going to breathe, and you've just taken another one. And the question is, as Dr. Spiegel puts it, what are we going to do with it? What are we going to go through? I got to tell you, listening to Mr. Spiegel today, I'm blown away because what he went through is what we've been going through as a family for the last 35 years. But here's what I can tell you. You're breathing. You have a gift. Live. Live with every ounce of life you've got. Now, 18 years later after my brother passed, which I got to tell you, I have moments today driving down the road. I had a moment 2 weeks ago where I'm driving and I missed him. and it's hell. Now, 18 years after he passed, my father, as I'm on my way home from spring training, in 1999, driving from Tucson to Phoenix, I get a phone call. I'm on I-10. I pull over because I hear the news my father was just diagnosed with multiple myeloma. And at the time, I bawled like a baby. But here's what my dad had to say. And I think this is what's important. He said, son, get your rest. You got to make sure that you work hard. You're getting ready for a big year. Does this sound like somebody just got diagnosed with something that sounds terminal? Hey, son, get your rest. You got to get ready for a big season. And he says, don't worry about me, because I'm going to win. See, this thing will not, and I do not believe in the word terminal, and cancer is not beating me. And I was like, wow. Now, that was 1999, and they found the cancer in him so early because the Yankees had gone through extra testing because Joe Torre had prostate cancer, and that they'd found a minor league catcher in their system with cancer, prostate cancer. So anybody's levels through a normal blood test, through a normal physical, they took precautionary. They took it to the next step. If they don't take it to the next step, they don't identify my dad's protein levels were way out of whack. They don't find it. Now, if they don't find it, and it grows, that's not such a good thing. But they find it so early they can't even treat it. And then 1 year later, the day before I'm going to pitch against the San Diego Padres, he says, it's time. He says, the cancer's grown. We got to do treatment. But make sure you understand something. I'm going to beat this. I'm going to win. And I believe in my doctor. I believe in the treatment. And I believe that I will beat this. And here's what I can tell you. That he underwent stem cell treatment where his blood counts were basically taken to zero. No immune system, right? While he was in his little bubble going through his treatment, his brother, who had been diagnosed at 59 years old with brain cancer, had died. Just when you think the story is going to come to an end, it's like, I'll be damned, right? Now, going to my dad's brother's funeral, while my dad was still fighting for his life, was something else. But let me take you to 2000. See, because he refused to quit. He refused to complain. He just refused to quit living. We would go into New York. I would go stay with my mom and dad. He was with the Yankees. And as I was with the Diamondbacks, we'd go in and play the Mets. And I'd wake up in the morning, my dad would be on the telephone. And he'd hang up and he'd get back on the phone, he'd call somebody else. And I'd say to Mom, what's he doing? She says, well, he calls cancer patients every day, people he doesn't even know. People have been diagnosed with multiple myeloma. He doesn't even know them, he just calls them. And he tells them he's not quitting and that they can do it together. And that he refuses to quit working. You see, later in 2000, I was pitching with a hole in my rotator cuff and torn labrum, ulnar nerve was subluxed, and all kinds of anything that could go wrong had gone wrong with my arm. But when we go into Philadelphia, and The Yankees have a day off. And you know, not one time in my Major League career did I ever put my father on the pass list. See, because when I was in the American League, he was in the National League with the Mets. And then when I switched to the National League, I thought this is going to be great. I get to see my dad at least and play against him. And that same year, he went to the Yankees. He switched leagues. We were never meant to be in the same league together. But as he was with the Yankees, they had a day off. That Thursday night or Monday night, I don't recall which one it was, but they had a day off and we were playing the Phillies in 2000. I got a chance to put my father on the pass list, and for me, it was the coolest thing in my 15-year Major League career. The coolest thing was not winning world championships. The coolest thing for me was putting my dad on the pass list, because it's the only time in 15 years, that one game, I got to do it. And it was in 2000, and put him on the pass list, and Roger Riley, our traveling secretary, came to me about an hour and a half before game time. He says, "Is this a joke?" I said, "No, he's coming." And him and my mom came to the game. And they were kind enough to sit my dad right next to in the owner's box, right next to the dugout. And it was a rainy day in Philadelphia. And my first time up, I hit a home run to left center. Now, I only tell you that is because I never even come close to hitting a home run in my career. But on that night, my first time up, the first pitch, I swing, somehow the ball goes over the fence, I hit a home run. Now, I only pitched a little under 6 innings because my arm was beat up. And we scored enough runs to make me look good on that night. I was the winning pitcher. And you know, I met my dad underneath the stadium. And this is a moment I think I'll never forget. You see, and I meet him in this tunnel, right outside of the clubhouse. There's a tunnel in Philadelphia, underneath the stadium. And I'm facing my dad, and he says, "How are you doing it?" You see, I looked at him, I said, "Dad, tell me, how are you doing it?" You see, because he had a chemo bag underneath his jacket. The same chemotherapy that was being pumped into his system while he maintained being the pitching coach for the New York Yankees. Refused to quit. Now, when he was diagnosed, they said, "We're going to do everything we can to give him a quality of life for the next 3 years." That was 11 years ago. He can do everything I can and more today. There's only one reason, and I believe this, and I don't even care if you call me crazy. And it's because his treatment started right here and right here. He believed it in his mind and in his heart that he wasn't going to allow cancer to affect the rest of his life. Today he golfs, fishes, runs the treadmill, travels to Arizona to hang out with his grandkids. And he has been, along with my brother, hands down the biggest inspirations of my life. Let me close in saying this. You have a choice what you're going to do with your next breath. And I've been very, very interested in personal growth over the last 18 months. And have taken on mentors from different people. But I'm going to leave you with this, a quote, but I'm going to paraphrase it because just in case it's not exact. But Mr. George Zalaki says this, and I believe this. And this is what I'm going to say to everybody who is a survivor today. Dance like nobody's watching, sing as if nobody's listening, and love like you've never loved before. Ladies and gentlemen, I have been blessed to be here today. Thank you so much.
That was a home run, Todd. Thank you very much. No.
Can you hear me now? Can you hear me now? Okay, now my cortisol levels are slowly starting to rise because I didn't quite get that under my belt. Hopefully by the end of the night tomorrow morning, it'll still be high. So Todd, I want to thank you for coming and telling that heartfelt story. And what it's going to do is going to actually lead me into my first question. Ultimately, the wellness community, we see the impact that cancer has every day, not only those that are diagnosed, but also on the family. We truly do feel that cancer is a family illness, and it affects absolutely everybody from the young to old. So the first question that I'm going to ask, Doc, is going to be, tell me a little bit, we saw the slide where it talks about maybe 25% of folks diagnosed with cancer have distress severe enough to warrant a diagnosis like major depression.
Yes.
Tell me maybe about the research of the caregivers of the family. Do they suffer from the same types of stress and the same types of depression?
Yes, they do. There's no question that caregivers are often the sort of the hidden aspects of stress. And you heard very movingly from Todd about what it's like when your brother or your father or someone else in your family is sick. And unfortunately, you feel like you don't have the right to have your own set of problems. So it's a problem, but it's a hidden problem. So the level of anxiety, depression, is very real. And yet people feel very bad about themselves. They say, I'm not the one with the illness. I should be fine. I should be helping them. And yet you have every reason to be worried about the health of your loved one. You're worried about the effects on the family's life. You're worried about on the things you have to take over from someone else. I had one patient who was very ill with advanced breast cancer, and her husband was trying to do everything. He was trying to cook dinner and take out the trash and do the laundry, and her son, actually she was in bed, and her little son needed some help with his homework. And the father said, I'll try and take care of it after I do the dishes, so just wait. And he heard his wife screaming from the bedroom, I can't cook, I can't clean, I can help our son with his homework, let me do that. And so sometimes, actually, the person with the illness can be very helpful to their loved ones and kind of reassigning tasks and helping them find things that they can do even with the illness. So there's no question that the levels of depression and anxiety, while they may not be as high as they are with people with cancer, are elevated. It's a real stressor for everybody.
Thank you. A question that came frequently was whether or not this presentation is going to be available on the internet. It will be available. We've got Son in the back. Thank you, Son, from the U of A Medical School, is taping it for us. Go ahead, give Son a hand. And hopefully with that hand, he'll spend the next week diligently getting us the copy so we can put on the website, hopefully as soon as possible. We appreciate that. You know, I'm going to paraphrase the next question that came up because I think it's an important question. Really what somebody's talking about is if a positive mental attitude, decrease of depression can actually, lead to better outcomes. Here's somebody who feels, is it fair to blame me for a recurrence? Can negativity cause a recurrence?
Yeah, that's a common question, and it kind of makes me sad because it's bad enough to have cancer. You don't have to blame yourself for having it or making it worse. And when I'm talking about positivity, I admire, like what your dad and your brother went through and how they were taking it head on. But they weren't blaming themselves, and your brother, at the time he knew he was dying, was not blaming himself. He knew he was fighting until the end, and that's admirable. So the idea that you can fix the whole thing in your head and somehow it'll magically be fixed in your body is just wrong. There's no evidence for it. It's not true. So it is better to deal with your anger, fear, and sadness, with your depression, because your quality of life will be better and maybe your quantity of life will be better. But the converse is not the case. Putting on a smiley face and acting as though everything is fine isn't a good way to cope with stress, and it doesn't help you with the illness. So the thing to do is to take it head on, take it seriously, and live as well as you can, as long as you can, but don't blame yourself or anyone else if the cancer finally gets you, because it's not because you failed, it's not because you were negative, it's because cancer is what it is.
Probably about 25% of the questions we got all related to sleep. And I notice every day that sleep is a major issue for cancer survivors, as well as family members. If you could take a few minutes, maybe a little bit longer than maybe some of the other questions, and talk about ways that people can actually start to improve their sleep, whether it's through melatonin, whether it's through exercise, nutrition, and so forth, please.
Sure. So to improve sleep, you can come to talks like mine that can you know, sleep is very important, and one of the problems we have in our culture is that we do all kinds of things that interfere with sleep. We take all kinds of substances that can get us stirred up at times when we ought to be calming down. We have these wonderful electric lights that allow us to stay up long past the time when our bodies are ready to go to sleep. As a nation, we're chronically sleep deprived. I don't know, how many of you actually get 8 hours of sleep a night? Good, that's good. But it's not by any means a majority of people. We need 7 to 8 hours of sleep, most of us, and we rarely get it because there are too many interesting things to do late into the night. And yet it's a tremendously important restorative time for our bodies. So I recommend a couple of sort of general health hygiene kinds of things. The bedrooms are for two things: physical intimacy and sleep, nothing else. So don't have anything that reminds you of work or other kinds of activity in your bedroom, no computers in your bedroom, nothing else. And the other thing is, this is a trick that actually helps with sleep. How many of you can see your clock from your bed, can see what time it is when you wake up? Okay, that's a bad thing. Change it. Because what happens is when you wake up in the middle of the night, early in the morning, and then you look at what time it is, that's an arousal cue. You're waking yourself up because you're so frustrated that it's 4 o'clock or whatever, 5 o'clock, whatever it is. So turn the clock around so you can't see it from your bed. Another thing is techniques for self-soothing. That is part of the problem if your mind is racing and you're worrying, going to sleep. Your body tends to respond. Your body gets activated too. So what I suggest that you do is imagine that your body is somewhere safe and comfortable, like a bath, a lake, a hot tub, or just floating in space. And keep your body comfortable and project your thoughts onto an imaginary screen. Just imagine that you're looking at a sort of movie of what you're thinking about, but separate from your body. You can't stop your mind from working, but what you can do is stop your mind from getting your body all aroused. And that can allow you to drift off back to sleep too. Now for medications, there are a lot of medications that people use for sleep. They tend to work for a short time, like zolpidem and some of the other hypnotic medications, but over time they lose their effectiveness. So they're not a good solution for a long-term sleep problem. There are some other medications your doctor can prescribe that are not so habit-forming, like Deseril, trazodone, which is an antidepressant that isn't used much for depression anymore, but is used because it makes you tired and sleepy and sometimes helps. In general, I don't recommend sleeping medication as a first-line approach to the problem, but it can be useful if the other techniques don't seem to work. And use it intermittently rather than all the time, because they tend to be more effective if you don't use them every night. The other thing is physical activity during the day helps you sleep at night. Unfortunately, we often don't get enough physical activity. We drive around in cars, we don't walk places, particularly when the temperature is what it is around here. But getting good physical activity during the day will tend to prepare your body to sleep better at night. So that's another thing you can do. And remaining physically active, even if you can, through chemotherapy, through all the other treatments you're having, is really good for your body, it's good for your mind, and it's good for your sleep.
Questions that people asked, a lot about creative visualization, meditation, and hypnosis. Do these have a role in somebody going through a cancer journey?
Yes. So hypnosis can be very helpful, as can mindfulness-based stress reduction. There are a lot of ways we have of changing our consciousness, in a sense, and that can help us change our bodies as well. Hypnosis is to consciousness what a telephoto lens is to a camera. What you see with great detail, but you're less aware of the context. How many of you have had the experience of getting so caught up in a good movie that you forget you're watching a movie and you just enter the imagined world? Does that happen to some of you? Good. You are likely to be more hypnotizable than the other people who didn't raise their hands. And it's a real talent. You can lose yourself in something. You know, if you start reading a novel and it's 2 hours later and you realize that you're late for dinner or going to someone, that kind of absorbing experience is a self-hypnotic experience. And it can help you change the way you feel psychologically and even physically. Hypnosis is very helpful for pain control. I had a young woman yesterday who had really terrible chronic pain and had been unresponsive to medication. She came in with her mother. She's had some abdominal problems that were very serious. She just was in pain and threw up before she walked into my office. And I taught her how to imagine that she was floating, and visualization, she pictured her intestines as being purple, as being sort of inflamed and angry. And I had her just imagine changing the color to green. And she opened her eyes afterwards and she said, I feel better now, and I feel energy I haven't felt in a long time. And her mom started to cry because she hadn't seen her daughter looking that good in a long time. So sometimes just changing the way you relate to your body. We often get very frustrated with our bodies. We get angry at our bodies for letting us down. And if you can treat your body the way you would treat a child and comfort it, and see things from a different point of view with techniques like self-hypnosis, with mindfulness. Meditation is a very useful practice. I'm sure there are programs here. We have it at Stanford. We have the Center for Integrative Medicine at Stanford where we teach mindfulness, and for 30 minutes twice a day, you sit still, you let your breathing calm down, you take that next breath in as a gift. You do a body scan, you just sort of wander through your body and see how it feels, and you focus on living in the moment, in the present, rather than worrying about the past or the future. And that can help people find a way of calming. I think one of the things that's worse about stressors like cancer is not just what it is, but it seems like you'll never be free of it. And yet people who have been through this know there are bad moments and there are good moments. You know, there are funny moments that have to do with cancer as well. And people learn that they can be sad at times, but they don't have to be sad or frightened all the time. And these techniques, like mindfulness and hypnosis, can help give you variations so that you get relief from that constant pressure of the disease, and they can be very helpful.
I think what's interesting to me is if you take a look at a lot of these techniques, mindfulness-based stress reduction, yoga, hypnosis, relaxation, visualization, guided imagery, it's a little bit like Mexican food. It's really all the same in a different package. You know, if you want a burrito, it's beef, lettuce, cheese, sour cream, and a tortilla. If you want a taco, it's beef, cheese, lettuce, in a crunchy shell. But really, a lot of people focus on tuning in your attention, focusing on your breathing, and really kind of getting that hyper-awareness of the one thing in front of you. So,
well, I think that's true. There's a lot in common. And my sister knew I was very interested in hypnosis, so she did yoga just to do something different.
There was a couple of people that asked if you could go through the acronym FACES again.
Yes, I can actually. There we go. So the acronym is just a way of remembering how to handle these stressors. And the first is face it rather than flee it. There's a tendency to run from it, to back away, I don't want to deal with it. And looking it right in the eye and saying, okay, what is it that's really worrying me the most? And then you begin to be able to think about what you can do about it. So don't turn your eyes away, look it right in the eye and decide what you're going to do about it. Alter your perception. Now this can be something like changing the way you feel, changing your perception of pain, changing your perception of your situation or your life trajectory. That you may decide, if I'm not going to live until I'm 95 and die in my sleep, what do I want to do in the time that I do have available to me? So you alter your perception about what's important now. It's not about having hope or not having hope. It's hope for what? How am I going to live with the resources that I have, and how can I best live with those resources? Cope actively. There's nothing that happens to us in life that we can't do something about. We may not be able to change the outcome, but find some aspect of the thing that's stressing you that you can do something about and do it. Express emotion. Emotion is your friend, not your enemy. You saw some lovely examples of that here tonight. It's a way of telling us and the people we care about what's important. So express, don't suppress emotion. And social support is crucial. Don't go it alone. We're social creatures. We've survived on this planet because we learn to help one another when we're not busy killing one another. and social support is a survival mechanism for human beings. So use that social support, seek it out, find it, cultivate it.
Two-part question, kind of put two of them together here. Does social support necessarily mean group therapy? Can friend survivors be as effective as support as formal group? And is there a difference between individual and group support?
That's an interesting question. I think, look, social support of all kinds is good. And it's not like one is good and the other isn't. Family, friends are wonderfully important. I will say, though, that I've had women in support groups who have wonderful families and husbands. I've met them. They're terrific. But they say, you know, I know how much it upsets my husband when I talk about my fears of dying or my pain or something, that I'm reluctant to sort of lay it on him. Whereas when I come in this group, I'm upsetting you, but you know what? You're upsetting me too, so it's even. And the other thing that happens in groups is that people make what has been called downward social comparisons. So what that means is they find something to feel good about in the other people in the group. So one woman who has bad cancer but a nice husband looks at another woman who has good cancer but an absolutely terrible husband, and she says, you know, I'd rather have this disease than have to live with that guy. You know, and the other one says exactly the opposite. She says, I know I've got this bastard, but at least my cancer isn't so bad, you know. So they find ways to kind of make comparisons and comfort one another. I think the group support is powerful and complements what happens elsewhere, but that's by no means to say that other kinds of social support are not helpful. There have not been many studies of individual versus group therapy. Both can be helpful. I think there are some added advantages to group therapy in that even, for example, very reticent people who don't like to talk about their problems a lot can get a lot from watching other people do it. And they begin to see that if they, you know, if you take a risk and say something, something good may happen. We had one woman, for example, who was so organized and obsessional. She worked in a medical practice that she delayed her mammogram for 9 months because she didn't want to take time off from work to go and get it. By then the cancer was a lot bigger than it otherwise would have been. And she was very reticent to talk about anything. And she said, you know, I don't think my doctor is paying much attention to me, and it bothers me, but I don't know what I should do about it. So we had another member of the group who was a dance instructor, completely flamboyant, wore wild clothing to the groups, you know, and was just a force of nature. And she said, well, why don't you just give him a kiss or something, you know? So the woman looked shocked, you know, but she came back the next week with a sort of sly smile on her face. Well, she said, you know, he was kind of ignoring me again, and I got off of the examining table, and I gave him a kiss. And she said, he's paying a lot more attention to me. So patients exchange a lot of very useful information in groups.
One of the antecedents or anecdotes that I hear frequently of people when they come in is that they'll tell me, I think my cancer was caused by this stressful time in my life, this particular stressful. Is there any research that really talks about the correlation, not of people who are diagnosed and how stress affects the progression, but prior?
That's a very interesting and difficult question, and the evidence is mixed. There's one study that was done in Finland among 10,808 women. They looked at stressors in life, which included death, loss of a spouse, loss of a job, separation or divorce. And they found that the rates of subsequent breast cancer were actually significantly higher in the women who had been stressed compared to those who hadn't. On the other hand, this doesn't happen in a vacuum, and you don't get cancer because you're stressed. You get it because there's a combination of the stress and whatever biological vulnerability is going on in your body. There are some other studies that show no relationship, and there's one kind of interesting study that showed an inverse relationship, that people who reported that they had been stressed earlier in life were less likely to get breast cancer. Now, that was an unusual study. Most of them either show no relationship or that stress is a factor. I think the reason is this. These were women who, if they were stressed, said, you bet I was stressed, and I didn't like it. And I suspect that that's protective. So I think the riskiest thing is if you're stressed and you don't feel you can or you don't do anything about it. So it's a mixed issue. We have to have stress in our life. If you're alive, you're going to have stress. It's part of life. And you don't avoid stress because you're going to avoid cancer. You have to, but I do think the message is to face it, to deal with stress when it comes, and make the best you can of the situation.
Are there any books that you feel every cancer survivor should read in regards to mind-body medicine?
Well, I've written one. I haven't done and that one is called Living Beyond Limits, New Hope and Help for Facing Life-Threatening Illness. There are, Susan Love has written some very good books on coping with cancer. I think there was a question about stress and cortisol, and a professor at Stanford named Robert Sapolsky has written a wonderful book on that kind of stress called Why Zebras Don't Get Ulcers. Zebras are really nasty creatures, and nobody has ever ridden a zebra, I can assure you, even though they look like horses. And so it's a lesson that he draws about how to handle stress. So those are some useful books about dealing with cancer and with stress.
This question, as a physician, at what point should I refer a patient for psychosocial therapy? At time of diagnosis, after surgery, radiation, in remission, etc.?
Well, this physician raises a couple of very interesting points. There are different kinds of stressors along the path. Now, we try to think of people as preparing for survivorship with cancer from the day they're diagnosed. And so, frankly, I think people can use help from the moment they're diagnosed, but often they're so busy finding out what's going on and making decisions about treatment and getting treatment that they don't quite have the time to do it. So I frankly recommend that if people are willing and open to get support, day one is a good time to do it. More commonly, though, and one of the surprisingly difficult times, how many of you found that the day you were done with active treatment, your chemo was over, your radiotherapy was over, you found yourself feeling kind of bad? Yeah, there are people. It's an interesting thing. You'd think you'd feel great. I don't have to go through this stuff anymore. But it turns out that it's a very stressful time because people suddenly feel, I'm not doing anything to fight the cancer anymore, and I'm just waiting to see what happens. They're also not surrounded by people who are used to treating the cancer and dealing with people who have cancer. And the other thing is people tend to postpone a lot of their psychological issues until they say, I'm just going to get through the chemo and then I'll deal with all this other stuff. And so the chemo's over and they've got to deal with it. So a good time to get emotional support, to come over to the wellness community, is after active treatment is over. That's often a time where people have more time on their hands, more to think about, and are more distressed than they would think they would be. So that's a good time as well.
We get a lot of folks that come when they're still trying to make some treatment options or treatment decisions as well, to just kind of bounce things off of other survivors. How do you differentiate between normal and abnormal stress?
Well, I would say that normal stress is, it's less severe for one thing. It's the sort of stresses and strains of everyday life. I would say that the abnormal stress or abnormal stress reactions is when you feel like you're kind of sinking in quicksand, that you just can't do anything about it, that things are piling on faster than you can do something about them. And so it's when you're starting to feel overwhelmed and you don't know what the next step to do is. And the other thing that happens with abnormal stress is that it disrupts your daily patterns. It's a time, for example, when people are more stressed, accidents happen. They don't put on their seatbelt. They get distracted when they're driving. A lot of bad things start to happen. They don't sleep as well. So then they're kind of groggy and not thinking as clearly the next day. So one thing kind of piles on the other. So I'd say when stress is beginning to accumulate, it's a good time to be more disciplined, to say, I'm under stress. I really have to take even better care of myself and my family. So I need to eat well, get exercise, sleep well, and make sure that I'm in condition to deal with these stressors that are accumulating.
Zach, the question is, how can we increase our NK cells? But maybe if you could just talk about ways that people can improve overall immune function.
Well, so there is a lot of interest in what we can do to help our immune systems do better. I would say good stress management is one thing. If those cortisol levels are abnormal, they will tend to be suppressing your immune system. We don't know, there are drugs that are used when people are really immunosuppressed. For example, when they're getting bone marrow transplants and other things, they can increase the number of immune cells, but we don't use them as a treatment for cancer per se. There are a lot of people selling dietary supplements and other things that supposedly increase immune function. There's not much evidence that that really works. So I don't know of any that I can particularly recommend. So I'd say in general, the best way to give your immune system a chance to deal with a disease is good stress management, good activity, physical activity, sleep, and exercise.
You talked an awful lot about brain chemistry, endocrine function, immune function, and so forth. Are there any lab tests to determine how the stress response system is working?
Well, there are, but they're pretty much experimental at this point. So one of the things that we do is we measure cortisol throughout the day, and now we're studying it at night too. One nice thing is that you can actually measure cortisol reliably in saliva, so you don't have to have a bunch of blood tests. You can actually just spit into a little tube and we can reliably measure cortisol. But at this point, it's still pretty much an experimental laboratory procedure. It's not a reference procedure like your cholesterol levels. It may be that one day we'll be able to do that, but I'd say that's not ready for prime time yet.
I got time for one more question. What do you think of neurolinguistical programming and maintaining a reduction in stress response?
Well, I think, like you said about the Mexican food, there are a lot of ways to kind of get to the same point. Neurolinguistic programming is a technique that was developed by two guys, Bander and Grindler, who used hypnosis, but the idea of NLP was to sort of manipulate the person, to figure out what senses they like to use and manipulate them to get them to be in a certain place. And it's an approach to psychotherapy that I personally am not comfortable with. I think good psychotherapy is an open interaction between two people where you encourage them to do things that will help them grow and live better, but you don't try to manipulate them into it. So, to be honest with you, among the array of psychotherapies, my taste for NLP per se is not all that high, but there are a lot of things we can do to help people face the illness better, live better, and hopefully live longer.
Thank you, Doctor.
Okay.
I appreciate it.
You're welcome.
Like I said, I'd like to thank Dr. Spiegel for coming out today. Flew all the way in from Stanford this morning, did grand rounds this morning, be flying out tomorrow. I appreciate all the work that you've done. Todd, I want to thank you for the powerful story that you gave today. I know how personal that is, and with a large audience, I know how daunting that can be. I appreciate that. Definitely like to thank all of our sponsors that made this possible today. I think it's an amazing thing that every hospital in Maricopa County that works with patients with cancer is probably in the room right now and actually an active sponsor of this program. It really shows how Phoenix, Maricopa County, and Arizona is really moving toward comprehensive care that treats all aspects of a patient, not just the medical components of it. We have 3 remaining parts of this series. September 15th, we're going to do an entire portion or program on sleep with Ruben Nyman, who is a professor at the Center for Integrative Medicine down at U of A, author of several books, very good program. We've done that before. We're also going to have later in the year Chris Carmichael, who is Lance Armstrong's personal trainer, to come and talk about exercise and nutrition. And then in February of next year, we're having Barbara Anderson from The Ohio State University, who was mentioned actually in the presentation today, is going to come and talk a little bit more about stress. Most of all, what I want to really be able to do is thank all of you for coming on out. The wellness community really does believe that people heal in community, and it's not about the staff, it's definitely about the community. Every program that we offer is free, and I've got a couple of answers of why that is. I think the first answer I always give is basically because when you go and you see a medical professional and you give them a $40 copayment, you're expecting $40 worth of cure. We don't want to be in the position that we are responsible for your cure. We want you to be in the position of being responsible for your cure. The second thing I always look at is how do you put a price tag on something that's priceless. But I think even more so is that at the wellness community, people heal in community because Annie is talking to Millie, and that's where they're getting the support. So how do I even get in the middle and start to charge that if it's the community that is helping each other? So if you haven't been out to the wellness community, I'm certainly suggesting that you all come down, just walk in the front door. We'll give you a tour. We'll show the place. Absolutely beautiful, but you're going to get a feel from it. We do have a wellness community table here, so if you want more information, you can certainly get that. So let's give all of our presenters today a round of applause. Let's give ourselves an applause. And as a Boy Scout leader, I can tell you troop is dismissed. Thank you.